Well, good morning. No, what time is it? Where are we? My name is Gail Strack. I'm the CEO of Alliance for Hope International. This is our monthly call with Developing and Open Centers. I am here with Michael Burke and Patricia Bauer. We're excited that we are all here. We were just talking before we hit kind of send. And I guess for us, we're reflecting on the horrible things that are happening around the world, whether they're hurricanes, fires, mass shooting, what else? It's devastating, but it's also hitting very close to home. Patricia Bauer's family has been touched by the fires up in Sonoma, and Wes Winters, as many of you know, the director from Sonoma, he lost his home as well. There's just a blanket of sadness, I think, across the United States and around the world, and certainly our office here as well. So we just wanted to first, before we jump into a PowerPoint, is just how is everybody doing? I think let's just do, Patricia, let's just advance forward to find out who's on the call. I think everybody knows us. Let's see, how do I get us to move forward? Everybody, I think, knows us, knows that the OVW has been a great supporter, and we believe highly in our guiding principles. We're grateful that all the folks who were able to join us in New Orleans, it was one of my personal favorites. Having the Leadership Institute and being together is really powerful. But as I started off with this call and how we started our meeting today with our staff is kind of say one word and how you're feeling. But let's take roll call first. Who's on the call?
So I'm just going to call people's names. And Rayanne, I see that you're on the call, so thank you for being with us. Also, Abigail Shirk, I think I'll call on you next. So just say your name, what center you're with, and the city that you're in.
Sure. This is Abigail Shirk. I'm with the Thurston County Family Justice Center in Olympia, Washington.
Great. Thank you, Abigail. Ron, thank you for being on the call today.
Thanks for having me. Yeah, I'm filling in for Misty Cedrin here at San Diego Family Justice Center because she is on her way to Italy.
Oh, wonderful. Probably a much needed and well-deserved vacation. So good morning, Catherine, or good afternoon, Catherine. You are up next. I see your microphone is on, but we can't hear you. So I will come back to you, Catherine. So Mary.
Hi, Mary Hauptsma with Essex County Family Justice Center in Newark, New Jersey.
Wonderful. Nice to talk with you, Mary. Susan, Kim.
Good morning, everyone. This is Susan Kim from the Contra Costa Family Justice Center. We are in Richmond and Concord.
Wonderful. It's nice to have you on the call this morning. Suzanne Stewart.
Yeah, Suzanne Stewart and my new Associate Director, Jan Feigert at the Tulsa Family Safety Center.
Wonderful. Nice to have both of you on the call. And Catherine, have you been able to figure out your sound? All right, well, we know you're there, Catherine Johnson. And Natalia, you are on our call as well.
I am. Hi, friends. It's good to join you.
Wonderful. Is there anyone on the call that I didn't call on or that I missed?
Okay, Patricia, can you hear me now? It's Catherine Johnson.
Yes, I can hear you, Catherine.
Okay, this is Catherine Johnson with the Guilford County Family Justice Center. I also have with me our Director of Client Services Coordinator, Sonia Desai, on the call.
Wonderful. Nice to talk to you both. Thank you so much.
Okay, well, as most of you have seen, we did fast forward through the opening slide so we can get to what we are thinking about today. Some of you may have heard our reflections. Our heart is with everybody that has suffered some sort of loss, whether it's through hurricanes, fire, earthquake, mass shootings. It's really a crazy time. But we did want you to know that in support of Wes Winters, who's one of our Family Justice Center directors, we have put together, thanks to Michael Burke, a GoFundMe to help Wes. He completely lost everything, as Patricia's family did as well. So I'm hoping we'll set up a GoFundMe there too, because I think this is a time where we all need to support each other. So I just want to open it up for anybody who wants to share what you're feeling right now before we go into the purpose of this call.
Well, and to note, we will send out a link to Wes's GoFundMe after this webinar is over, so anybody who'd like to help out can. So thank you all. It's just really a tough time for our nation to see what's happening across the country and around the world. And when we heard about Wes yesterday, our hearts just sank.
Yep.
This is Mary from New Jersey. I just can't help but I just want to say, you know, with all of the intense, horrific stuff that's happening in the world, you know, I just felt like, the Leadership Summit and, the tremendous commitment and energy of all the people who are involved with the Family Justice Center movement is such a wonderful counterbalance to all that ferocity that's going on in our world. So thank you. And yes, all those folks who have been affected by hurricanes, everything, has been awful since we were together. And so my thoughts and the thoughts and prayers of your colleagues here in New Jersey are with you.
Thanks, Mary. And I do think focusing on what is positive is what will help us all get through this. And definitely attending the Leadership Institute was a highlight for us as well at the Alliance. And yesterday, our Alliance team had the chance to walk over to the San Diego Family Justice Center and wish them a happy birthday. They are now 15 years old. And everyone gave big kudos to Misty Cedrin, the lieutenant who's been overseeing the Family Justice Center for, a little over 3 years. She has done some amazing work, and one of the things I will forever be grateful for her too, is that she recently was able to reopen the forensic medical unit in a place where it's never been before. So I am happy to report that it is fully functional and sexual assault exams are being done on site. I know we've got Ron here, and I'm sure he can share more when we get to the point where we share. But that was really a wonderful day for us. 15 years in the making, and a lot of hard work and energy was put into that. And you can see the love for the Family Justice Center all around, as we also saw survivors from the original voices there 15 years ago being able to reflect. And Michael, if you could see Michael's heart is kind of like melting right now, because the voices is a very important piece to all of this. But let me go ahead and jump in, because we really need your help. As you know, we put together a book called Dream Big, Start Small. This was our second book on the how to open up a Family Justice Center and keep it going. The first one was based on the San Diego model, but quickly we saw many Family Justice Centers open up around the United States, especially after the President's initiative. This book, Dream Big, Start Small, for those of you who don't know, was an update of the original book. It was put together in 2012, and it was a product of love from all the directors who were part of the calls at that time. And as we went through each and every chapter, we realized they were each important, and we had learned a lot of lessons since the original book. And our goal now, because that book was in 2012, is to have all of us one more time, and we are recording who's on the call, we're recording this call, is to now, we need you to share what you have learned as you have opened up your center, or you're in the process of opening up your center. As we've been going around from an open center or to developing center, we've kind of all realized all these chapters, whether it's buy-in or strategic planning, is important either before you open it up, while you're opening it up, and of course, keeping it going. Strategic planning is at the heart of it. So there it is. If you haven't seen the book, I think this is definitely one of those keepers. Many of you have heard me say that what we have learned over all these years are keepers, do-overs, and what the heck are we thinking? And I think in strategic planning, or if you're new to a center or been assigned to a family justice center, there's a little something there for everybody. So what we want to do is focus this particular webinar, or I should call it a learning exchange with all the directors, on Chapter 2, Strategic Planning. So, Patricia, I see you have this really cute cartoon.
Yeah, so I think when we think about strategic planning, we think about it being a chance for a shared vision. I think this kind of highlights Casey's point that if you're the only one who sees it, it's a hallucination, not a vision. So we really want to think of strategic planning as something that is inclusive, that includes many people, so that it's not just one person's hallucination, but a shared vision for where you want your center to be going in the future.
Yeah, I'm just remembering one of our prosecutors. He kind of like said, you know, poke me in the eye before I want to go to strategic planning when we were trying to become fully operational. And I would have to echo his thoughts, because I think as all of us think about strategic planning, there are so many other things that we want to do and need to do. So what Patricia did is she went through the chapter one more time and really pulled out some key things, which I think all of you are aware of, but it's a good reminder before we start to share. You know, the first one is you got to know where you're going and you got to have a plan. The second one is we need everybody there. We need the dreamers, we need the doers, we need the planners, and it needs to be a shared vision. If we're going to try to create a family justice center for our community needs to be involved. And in particular, I guess I'm reflecting too, Mike, on the Ventura strategic planning process. I thought they did a fantastic job of including survivors in each step of the way.
They also included funders, and I think including funders, from what I've seen in the last year and a half traveling around the country with you, is that when funders are involved in strategic planning, the positions can get funded at that meeting or at that table. We saw that happen in Oklahoma. We saw it happen in other places. So the survivors are a huge part of it, and also our funders.
And that's true. I think that's true for just about anything, even if it's not strategic planning. We need to be doing that for, if you're going to your city council, if you're going to a committee within your city or county board, everybody needs to be reminded of that. And I'm also thinking of Lieutenant Misty Cedrin. In one of the last meetings I was there, she opened it up with just 3 minutes from a survivor. And that reminder and that community meeting is so important. Why are we doing this? And I think the other part is that sometimes we just keep doing the work, and we don't hear why we're doing the work. And it puts you in a really good, solid place. And then a couple of other key points that Patricia pulled out about that shared vision and what we're trying to achieve. You know, buy-in from all the key stakeholders. And I think key stakeholders have come up so many times, like, who do you invite? Who do you invite? And I always look to the brochure rack, because I look for the biggest and the best brochure rack. And if you have a brochure from an agency, that person needs to be invited. And I think you also need to invite the people you may not like, because they still have an important point to make, and you can still win them over. And what we saw in just about every strategic planning, and I think every community needs to do this, is what are the blocks and barriers that keeps you from doing all the things that you want to do? What are those strategies? And it's been fun how we've spent more time in our current strategic planning process on strategies to overcome blocks and barriers, because we're seeing similar blocks and barriers everywhere we go. I mean, people think there's no money, but you really think about it, we have a lot of money. It's just our priorities are not set to what we're trying to achieve, or people don't know, or we haven't invited the right people. We're talking about plans, strategies, assignments, and timelines, because that gets us there. That's that pathway. And, you know, when do you do your strategic planning? We believe in strategic planning before, during, after, and then you kind of do it all over again. And then, of course, was there one part of the strategic planning process that has been most helpful for your center? So I think now we're actually getting to the point of where we can start asking input so we can have kind of a strategic discussion about this as opposed to a chaotic discussion. But I think at this point too, it's like all lessons learned are going to be helpful and they will be incorporated. So let's talk about strategic planning and tell us about your experience, and we will just start dialoguing and talking and having a conversation. Glad we didn't have adult beverages all around the table right now, because if we did, the ideas would probably be better.
How do you know we don't, Gail?
Cindy Brady?
I think you know who wants to go first.
Thank you, Cindy, for jumping right in and making us all laugh.
So I will say that I believe in strategic plans and we use them, and it is a great way to build. One of the items, one of my takeaways that I always tell people when they're calling me for advice is to fight the impulse to fill your building up immediately. Because I think when you do that, sometimes you ask partners that may not necessarily be a good fit. Empty space seems to scare people, but it is really true that when you build it, they will come.
Nice. Anyone else? What's your experience? What have you learned? What are your gems? What would you share with others?
We're not afraid to call on you by name. So Catherine, it's your turn.
I'm ready. I just unmuted myself. In Guilford County, one of the things that our community did was they did planning for the Family Justice Center really since about 2008, and our center opened in 2015. I came to the table in 2014, and people say to me all the time, "Oh my gosh, you're serving 6,000 people a year on site at your center." And I think a lot of that was attributed to the amount of work that our partner agencies put in, meeting every other week for over 2 years, having a lot of dialogue. It really built the investment, which I think has been a reflection of why our center has been so successful as far as serving a lot of people. We're, just celebrated our 2nd anniversary, and we kind of have like a launch phase strategic plan. And I'm kind of constantly balancing. Our community worked so hard to get the center open, like they felt like that was we have arrived, so to speak, and making sure that we continue to evolve, and how I've been working to encourage our partnerships to think beyond a launch, to think beyond the grand opening, and what's the next phase of our work, which is why we did programs like Camp Hope, and while we've got things going on in Elder Justice, because that's kind of breathing life into us. But I'll say some of my executive leaders, when I use the word strategic planning, they roll their eyes and say, "Can we call it something else? We know what it is, but can we call it something else?" Because they put a lot of work into it, and we've kind of seen the fruits of that effort.
That's a good point, though. Can we call it something else? Mm-hmm. What could we call it?
That's still what you're doing, though. You're still strategically planning to better serve survivors and their children. It's still strategic, right, and it's still planning. So that's an interesting question. I don't have anything off the top of my head, but it's just continued. I mean,
it's something to think about, because I always say if somebody's asking the question, there's a reason for it, and we need to address it. Okay. Right. Because you're thinking, you're dreaming, you're planning. We'll put that one on.
And I've talked about it in terms of like, I think you guys, when we talk about this at leadership conference, like you can't get stagnant, because if you do, then you become complacent, and you can kind of get.
Oh, did we lose you? Did we lose everybody?
No.
I can hear you.
Well, let's ask Suzanne Schultz, because you kind of came into a strategic plan you found in a drawer, right?
Suzanne Stewart.
Suzanne Stewart. I'm sorry. Yeah.
What now? The strategic plan in a drawer?
Didn't you find when you took over?
She found the snapshot report.
The snapshot report. Yeah.
Oh yeah, I found the snapshot report. report that if I'd seen it before I took the job, I wouldn't have taken the job.
Well, at least we're all maintaining our sense of humor today.
Well, yeah. But I think what that did was it gave me a place to start and the basis for change. And I think that's the thing that we all, you know, as we talked in the leadership meeting, you know, change is scary, and it all has to do with loss of power, or loss of money, or the loss of perceived power. And if you can, I hate to use this word, if you can be manipulative enough that your words and your actions reflect inclusivity instead of exclusivity, then I think that whole, and making somebody think something was their idea when it was really yours, then I think that you are probably going to be successful in incorporating your change. And I'm kind of experiencing, I had an interesting meeting this morning. You know, we're looking at combining with our CAC in a larger single facility. And we've signed a statement of intent. It's signed, it's done, we're going forward with it. And had a great 3-hour meeting with the person who is going to be their campaign co-chair with us on raising the money for the facility and the operating program. And we've been talking around and 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 around. Finally, we sat down and we said, okay, just tell me what your thoughts are. And it just, by that simple statement of tell me what your thoughts are, her thoughts and their thoughts were the same as ours. We were just using different words to describe it, right? And so once we agreed on a common language and a common lexicon that we were going to use in calling things, we were calling things, all of a sudden it's all hunky-dory. Now that doesn't mean there aren't going to be some details to work out, but now we're talking the same language, we're on the same page, and we're going to go forward with a really great project for our community, and it's going to be in lockstep. So I think as we talk about planning and visioning and strategy and what you're going to be when you grow up, you've got to keep all of those things in mind, and that it's as much a process of selling a rug, you know, a machine-made rug to a handmade rug maker, right? You want to make sure that somewhere along the way you're talking the same language, and that you may take different paths to get to the singular goal that you've established, but you're delineating those paths in the same way, and your outcomes are going to be agreed upon, and you can move forward with a positive experience for everybody. So I guess that's my 2 cents.
Thank you. And you're right smack in the middle of it right now, that's for sure. Reinvention and your dreams have gotten much bigger, so that means you got new partners.
Oh yeah, we've got huge new partners, and we're going to have even more partners by the time we're through. So our intent now is to be strategically realistic on our limitations and not overdream for where we want to be, but always have in the back of our heads that 2 years from now, once we're in and the doors are open and we're doing business, we need to be ready to be thinking about what is going to be our capacity requirement after a couple of years and track that very closely. And as we plan for where we're going to go with X amount of space right now, we need to be ready to think, okay, maybe at some point we might need more space. And if so, how do we plan for that as we plan for plan A? What is plan B 5 years from now?
So Suzanne, for the people that don't know, will you share what your plan is?
Well, essentially, our plan, we started 2 years ago with a strategic planning process, actually, that Jan, who is now just come on as our associate director, actually conducted the strategic planning process for us over those 2 years. She was with an organization called the Community Service Council and has a long history as their guru for all things strategic and healthcare related and human trafficking, and I mean, amazing background. And we were able to get her to join us as we're losing Darcy Melendez, who's been our associate director here for the last 4 years. And so we started with this process 2 years ago, just convening all of our community stakeholders, not just our partners, but funders and other people that we interact with somewhere along the way, to talk about domestic violence and sexual assault and child trauma and all that kind of stuff in the community. Where do we go from here? Because we were seeing our numbers just really increase. And simultaneously with us doing that, our Child Advocacy Center was also going through the same process with their programming. And they've had some staff changes, and they had some kerfluffles with the capital campaign for their own facility, a standalone facility, some other serious organizational issues that they were dealing with. And it just seemed like a perfect time for us to walk in and say, hey, we're going to do this program. We think it makes sense for us to combine our strengths into one facility, since we're all dealing with the same families. And our community in Tulsa is really huge on collaboration, on collective impact, on backbone organizations. And, you know, both the Child Abuse Network, which is the Child Advocacy Center, and the Family Safety Center, all fit those definitions. So we thought, so it's going to work. So as we thought about what that should be, we also have a partnership with the University of Oklahoma Tulsa campus, and in research, and the School of Social Work, and the Peru Training Facility. And we thought, wouldn't it be cool if we could be located on a campus facility where we could pull the School of Medicine, we could pull the psychiatry people, we could pull the social work school, we can pull the training facilities, we can pull research, all of it into us, as well as the CAC and the Family Safety Center. And so what we're looking at now is a 100,000 square foot facility on the campus at OU Tulsa. The regents for the University of Oklahoma and the president of the university have both given their blessing, and will receive a $1 a year ground lease for 50 years with renewal. Wow. And we'll be able to own the building. So we're looking at a $27 million campaign with $17 million for the building and maybe 10 for operating expenses over a period of 10 years. So that we've got that taken care of. And we're setting up a joint committee, a joint fundraising capital campaign committee, to be able to fundraise for the facility. We're looking at how we operate and govern the facility and the partnership, and looking at shared space and independent space. They certainly have their own criteria. We have ours, but there's lots of shared stuff and lots of pathways that we'll be creating for our clients to navigate through the system. And we're trying to fast track this through as quickly as possible so that we can get started and be open in 2020.
Wow, that's ambitious.
What?
Let me make sure I got this straight. You're going to do all of this by 2020?
Yeah.
Okay. Did you hear her confidence?
I heard the confidence, and I heard Michelle Morgan's going to have to even expand bigger if Texas wants to be the biggest.
I know. And then, of course, we've got Milwaukee with 72,000 square feet. And now San Diego is dreaming big with our DA and city attorney.
Oklahoma's dreaming big. I think they've got 72 that they're working on. So it's the future, I think, and a lot of these communities are driven by a couple of things. It's going to be driven by survivors and what our families want to see happen. Secondly, it's going to be driven also by dwindling resources. In the state of Oklahoma, our state budget is in such a horrible crisis that we just learned Tuesday because our legislature has not been able to get their crap together enough to agree on budget funding sources, revenues. We're one of those states where it's all Republican led. And no offense to Republicans out there, but in Oklahoma, that's like a recipe for disaster. And they refuse to increase revenues. And so our Department of Human Services, which is, vulnerable people, the Department of Health and the Mental Health, Oklahoma Department of Mental Health, are all three agencies that are going to be taking $25 million each plus cuts as of this week in this budget year, in addition to the $100 million, $125 million worth of cuts they've taken in this past few months. And so we're going to be losing programs. We're going to be losing kids out of insurance programs. We're going to be losing families out of insurance programs. Mental health, people with mental health problems are not going to be able to get services. Abused adults, elder people are not going to be able to get services. It's just a freaking nightmare, and they're expecting the philanthropic community to pick it up. And Tulsa has an incredibly vibrant philanthropic community. There's no doubt about it. But their tolerance for the lack of government-supported services is just about on the last. That's the last straw on the camel's back. So as they expect organizations to be more collaborative, to be more efficient, to be more economical in terms of how they do their work, they're expecting many organizations to lead the way in being able to do that, including United Way, who is expecting organizations to unsilo and be more collaborative. The private funders are doing the same thing. So quite frankly, just from the basics of survival, of being able to provide these services to our families, we've got to be able to work together, and we have to be able to collaborate in a fashion that is going to serve their needs, but it's also going to be efficient and economical in our community. And I think those are the two things that are going to drive everything that's going to happen in the country for the foreseeable future, until some kind of change happens at the federal level and or at state levels where you don't have a lot of diversity in the political process and no appetite for support of human and social services on a governmental scale.
Wow. Well, your dreams are big, and it looks like you're going to have some challenges as well. So if you were to say, what's that one thing that you're going to need out of your strategic plan to make your dreams come true? What's the most important or most helpful for you?
A clear vision for 25 years.
Okay. Thank you. And in fact, I think
$25 million.
Take a poll right now, or my hands.
They can type it into the comments.
Because I think a good question to know is how many of you on this call have a strategic plan, a live one that you're using?
A quick way to do that.
How do you do that?
So everybody who has a strategic plan you're using, say yes, and everybody who doesn't, say no when I say three. Okay, ready? 1, 2, 3.
Yes.
Yeah.
I heard a couple of no's, but a lot of yeses. That's the informal poll, Gail.
Yes, that is the informal poll, and that just works perfectly. But strategic planning is key, and I think the hard part is always keeping your strategic plan alive too. Because I think while people will commit to a couple of days for that vision, those work groups are key, and then it always kind of goes down to a few people. But I also think that's okay, because the big group is to get their input, their buy-in, their support, and if they trust the process, they're not going to be concerned about it. And a lot of people, I think, end up going to the process just to see what's happening and make sure nothing bad is going to go on. But let's keep downloading great ideas so we can improve this particular chapter on strategic planning. Who would like to share next? And if not, we will call on you.
This is Carol. I'm just reporting in. I was at a meeting. I'm with the Stanislaus Family Justice Center.
Good to see your name. I saw your name pop up, and it's always great to hear your voice. We missed you at our Leadership Institute. You're always one of the faithful, loyal ones, and you share so much. So thank you for juggling your calendar to jump on. So Carol, what have you learned about strategic planning and you want to share with others?
Well, we did start with a strategic plan. I think we had a 3-year strategic plan. And it really, I think, comes down to who's doing your strategic plan as far as who your partners are. We have had now the same partners going on 7 years, November 1st, and we've been able to add on, but those core partners have been a part of it, and I think that's key in continuing. And the stakeholders, the county, the city government people, that's important too. I was just at a meeting with the Chief Executive Office of the county, asking them for some support for the building, basically, and paying lease or whatever. And it's something we haven't broached them with since we started as a public-private partnership and then had to switch to a nonprofit when the budget crisis hit. And they all are aware of us, they support us, and they're looking now for ways that they can, in fact, support us by perhaps paying for our lease. So you've got to have the buy-in of those stakeholders. That's all in that chapter. I know I don't know that I have anything new. It's just what you have written there is important. You have to have buy-in from those top people and from the partners.
Okay, thank you. Anyone else? We've got a couple of questions up there on your screen.
This is Mary from New Jersey.
Hi, Mary.
Hi. So we started with a strategic planning process. A steering committee was established to plan for opening. And then after we opened, 3 years after we opened in 2013, we had a long-term funding and strategic planning session. Gail and Casey came out and facilitated that. So periodically, I just go back and review that and update it, to see where we're at in terms of meeting, benchmarks, and I'm realizing as I'm listening in this conversation, that we've been working a strategic plan, but we haven't been reconvening to, get input from stakeholders on revising the strategic plan or updating it. So coming away from the Leadership Summit, I realized, we have completely failed. We have an Active Voices chapter, but they haven't been involved in decision making. And so that's something we're committed to doing. And so, I'm thinking that now is a good time for us to reconvene with stakeholders to, evaluate where we're at in terms of strategic planning. There have been a lot of great developments at our Family Justice Center and in the state interested in expansion of the model. So I think this is an important time to revisit and revise the strategic plan.
Nice. And you've just kind of reminded me of some of the keepers. I would say for us, we got a little grant for 3 years, $20,000 a year, just to maintain our strategic plan. And as many of you know, we had Judy Adams helping us. And one of the things that we did to keep the strategic plan alive is that we convened as a group every month. It was our FJC day at the FJC. And we were able to come up with 3 key strategic directions that we wanted to achieve. And then we had the work groups working within those strategic directions. So we took that big plan and then really focused in on 3 specific things we wanted to accomplish. We also agreed not only would we meet every month, but we would reconvene the big group every 6 months. And I remember reconvening those groups every 6 months, kind of almost hyperventilating, because we were all working so hard, we really didn't think we accomplished that much. But once we got back together as a group, we realized why we were so tired, because whether we were doing it very intentionally or subconsciously, we were living and breathing that strategic plan because we were revisiting it every month. And then it allowed us to just kind of keep on going. And then when we reconvened with the group, it allowed them to see the progress. It allowed them to really buy into the future. And if we needed to make any adjustments along the way, that was the time for all of us to discuss it. And I think we could have done better of incorporating more survivors at the time. And I think going forward, survivors are the key. But go ahead, Mary.
Yeah, but I have a question for you. Now, did you engage in that process and have those regularly scheduled meetings with stakeholders who were involved in maintaining your strategic plan, in addition to regular meetings with your FJC partners, or did they wind up being sort of merged?
We had so many meetings, it was almost impossible to kind of keep track of them all, but they were all very necessary, painful but necessary. And I think if you stay focused, it was helpful. So we had a community partners meeting, which, that was keeping everybody informed. We had a steering site committee, and that was a very smaller group helping us manage the day-to-day. And that included, both the city attorney's office, the police department, and key partners to make sure that everybody's voice was heard. But the strategic planning, we called it the blueprint team, because they were the ones that were taking out that strategic plan every month and going through it. Because we were so excited to be co-located with the police department, we didn't have chairs or co-chairs. We had like lieutenants and sergeants. And so we kind of borrowed their names. It was kind of fun for us because that was the first time people were co-locating with the police. And I think the other key to success was definitely feeding everybody at those meetings. And because we had support from Judy and her staff, making phone calls to not only send out the email to invite folks, we called people and
remind them.
One personal touch saying, can we count on you? We need your help, which we did.
Right.
I think when they make that personal commitment to you, they're more willing to show up.
It's about the relationships. I mean, Family Justice Center is about relationships, and so are strategic planning. So I'm curious with Mary Ann, we were out with you in Morris County, and was there one part of the strategic planning process, now that you've been open for a while, that really stuck out to you? I remember being with you at the strategic planning process, and now that you've been open and you're an active director, what was something that really stood out?
Can everyone hear me?
Yeah.
Oh, good. Hi, everybody. And I'm sorry I missed everybody at the Leadership Summit. I hope it was a good time. I hope to join you guys next year. So one thing, and we were lucky, very lucky to have the Alliance come out to help us with our strategic planning last year. So we opened March of 2016. And I think one big thing, a lot of things stuck out from that, but the ongoing, and kind of what Gail has been saying, is the ongoing, all the meetings, sometimes when you're in it, seems very chaotic, and just you're having a meeting about a meeting and these subcommittee meetings. But everything, looking back over the past year and a half, all those meetings and all of those discussions are so crucial. We do have monthly operations meetings with the on-site staff and partners. And we also have quarterly oversight meetings with more of the stakeholders and the community partners. And shortly after we were opened for 1 year, I looked back and went through, kind of surveyed the community partners, surveyed our on-site partners, our staff, clients. I did a 1-year evaluation of our Family Justice Center that was very time consuming, and I put together a pretty big summary and went back and looked at our strategic plan and made sure that and compared it to what we had going in and opening to where we were a year after. And it was very interesting. A lot of it we're on track with, but then other things that we're changing and we're moving in a different direction. I think just the biggest picture thing that I think is important to always remember is that planning and ongoing planning, crucial, but always be open to revising that plan, because you can do all the planning you want and then somehow it seems that I'm just going back and redoing it. So I think that for me has been the biggest thing, just the openness to change and revising and always going back and looking at it.
Good.
Marianne, this is Mary. What did you, what was like the takeaway from the evaluations that you did? What outcomes did you find? Yeah.
So I went back and I kind of took out suggestions, recommendations, some long-term goals, short-term goals. So I categorized them in various different ways. So, but all over the map. Some suggestions from clients and partners and staff here on site, as little as, a garbage can in the living room would make a big difference. So little things like that. I know it sounds funny, but things that I can short-term, that I can kind of find a resolution right away to, and that makes a big difference to clients and on-site staff.
Sure.
To as big as, mental health clinician here on site. And that's something that we're already talking to community partners to try to look at and because we do not have a mental health counselor here with us.
Right.
So very small, concrete physical suggestions, they just ranged. It was so many different things. It was amazing to see the client feedback as well, and then the staff feedback, and then feedback from people that refer to us on an ongoing basis, but aren't in the day-to-day things and what they think, what suggestions they had. Did that help?
That's great. Yeah, no,
Yeah,
that's great that
and
you did that, got that, solicited that input from that,
It was very
of,
eye-opening. And Mary, I can connect with you. I can go more into details about the evaluation.
Yeah, funny.
There are some
So
things you
busy.
wouldn't think about.
Okay. Okay, great.
Marianne, I think if you're willing to share your partner survey, I think that everybody would probably love to do that. And I think it's very wise to do that every year. And hopefully, we're doing that with our survivors on a daily, monthly, and basis and reviewing those. I remember when I reviewed the surveys, and it's important to share those surveys at your monthly meeting so they get to hear. And you're right, those little things would come up. Whether, I remember one of them that came up is that they felt cold, but once you understand trauma, maybe it's not necessarily it was cold, but the trauma and what they were going through, the fear. And then I remember telling that story to my next door neighbor, and then a week later she started delivering little quilts and Afghans that her whole knitting club started to dedicate to this. So you never know when little magic can happen. Through those surveys and feedback.
Yeah, and I think it was time. I think it's also important that the surveys. So we did a bunch of different ways to survey people, and we did do anonymous surveys, and we do those on an ongoing basis. But this evaluation, I really tried to do this all in person as much as I can. So I went through the different programs in the community. I went to meetings, stakeholder meetings. So I tried to do as much as I can in person, which was the time-consuming part. But that's what I felt like I got the most genuine and honest feedback from other people, being there and having these discussions with them.
That's interesting, because I've heard from others that an anonymous survey will get the most honest feedback, but you're saying that one-on-one personal contact relationship building that they were willing to open up and share with you.
Yeah, I found that in a way that the surveys, sometimes I would get some generic answers back, but my presence, I think, in some way made them feel that, I was very invested in this and that I did want to see a change, or I wanted, to see improvement. So they were more willing to have a longer discussion with me rather than give me, one or two word answer.
Nice. Well, thank you. That's a good reminder about that. So I know we're kind of wrapping up our time, so we want to hear from everybody. Let's see, going down the list up. Abigail, do you want to share any?
Sure. So again, this is Abigail. I'm in Olympia, Washington. Our center's been open for about 4 or 5 years at this point. I joined our center in 2015 as our program manager. 2016. And so there was strategic planning done before the center officially opened. I think in 2012, we had a big strategic plan with all of our, partners and agencies and future partners and stakeholders. I think there was about 60 people who participated in that. And then in early 2017, we had a staff retreat for our Justice Center on-site employees and partners, and sort of did a mini strategic vision over what we'd like to see this year. But we're on the brink of a capital campaign, and so I think more strategic planning is coming our way. But I do really enjoy hearing, I think I get a lot of feedback about the meetings we have. We have monthly CCRT meetings, weekly huddles, operations, leadership, but I really appreciate hearing that we're not alone in our meetings, because I think they are all important. And now I'm even eager to pitch maybe that we need to have sort of either quarterly or some specific time to focus on our strategic plan, and more so build on from what we're at, because I think ours is getting outdated at this point, and it's time for us to do another one. So,
okay, well, thank you. So I'm hearing that we're on the right track, and
Finishing
more is
fall.
better than
Would you
less.
mind waiting? Okay.
So let me go to Ron Bailiff. How are you?
Good. So a little different spin. Now that we've been open for a little while, we actually get quite a few number of people who come in wanting to start either family justice centers or centers that are mirroring the Family Justice Center. Matter of fact, we just had a cadre of police officers from Guam who are starting a family justice center out there. So they came to visit and wanting to know what we do, how we do. And a lot of our conversations that we have with these folks are really about strategic planning and getting them to kind of start to think a little bit bigger than what they're doing with the basics. They have the how they're going to finance it, where it's going to be, and who's basically going to run the organizations. But putting all the pieces together as to who the community partners are going to be, how are you going to select those community partners, how are they going to finance themselves, getting survivors involved with helping you is really a big key to our conversations. So a little bit of different spin. I just wanted to add that.
Well, thank you. We really appreciate that. So we're going to go right down the list. Looks like Jay Johnson. You're up. If you're still on the call.
You just muted right now.
Let me give him how about, well, while he's unmuting, how about Susan Kim?
Hi, everyone. Sorry that I missed New Orleans, but hopefully I will join you next year. So the Contra Costa Family Justice Center started as a pilot project in 2011. So there was the first strategic planning process we did. And then when we opened our Concord Center, there was another plan. And then right now we are currently engaged in another planning process. And what we have found is that the plan itself as a document is really good document for recording history and also giving a snapshot of what has happened. And also it looks for grant proposals. But the process actually of putting together a plan, I think really brings out more strength and opportunities. So in the current planning process, what we have found is that while we have established as a collective impact backbone support organization, that's not enough. And that we really need to strengthen our community building and community engagement projects and programs, and also really think more about prevention efforts. So again, the document itself really is a good historical document, but I think through the current planning process, we have identified the need for more prevention efforts in our community. So that was really encouraging and new finding. As far as partner surveys, we've been doing annual partner survey every year, and I think it's helpful to do it, with the same questions. I mean, we have found, we ask the same questions. We've been doing it for 3 years, so we have a 3-year compilation report that actually I could share with you all. And what it shows is that in year 1, when we surveyed our partners, about 20 partners participated. And then last year we had about 45 partners participated. So we actually have seen an increased participation by our partners in our survey. So we found that encouraging. And I think our report looks kind of interesting, so I could share that with you.
That'd be great. So what are some of the highlights?
Yes, so one of the questions we asked is, the Family Justice Center is responsive to our needs and requests. So in 2015, 80% of the partners said yes, and 2017, it was 98%. So the number has really gone up. And also, another question was, Family Justice Center gives us the ability to connect clients with more resources. In 2015, which was kind of our foundation year, we opened 2 centers. That number was 68%, and 2017 it's gone up to 84%. So it's nice to kind of track the trends by asking the same questions. And our survey tool, I think, is fairly simple, and we don't ask too many questions. So I think, I'm glad that a lot of our partners have participated.
Awesome. Yeah, I think that's going to be a great tool to share. And as we wrap up, I'm going to come back to Catherine, because in our Leadership Institute, Catherine, you mentioned, talk about tracking. Didn't you take the HOPE scores of your partners before you moved in?
Yes, so we took some of those HOPE index questions that were kind of applied to what was being used in Camp HOPE and some other things that Dr. Hellman had put out, and incorporated those HOPE index questions into our professional feedback survey, and then asked some of those other questions that Suzanne mentioned as well, around like, do you think people are getting what they need? What other barriers do you think? Those types of questions were included in our professional feedback as well.
Great. And I forgot to ask you when we were in New Orleans, but are you willing to share that? I think these tools would be great for the next chapter.
Yes, so I am willing to share that, and I've worked with the faculty member with UNC Greensboro who I'm working with. We've tracked this for 3 years now, so she's looking on doing some publishing and some things around our information. So she and I have already had one follow-up since the conference, and we have a data meeting next week to look about how to just kind of take all the stuff we've worked on and share it out in a format that can be replicated.
Great. And what are some of your highlights that you have found in the last few years?
I mean, I think like general highlights, you think, or around professional feedback?
Just general, just so we get a sense of what's happening.
I mean, I think and as I mentioned this a little bit earlier, but one of those big highlights was just the way that we have just improved access to resources and kind of seen a large demand of folks coming into our center. I think Camp HOPE has provided some momentum for our community. We have a lot of initiatives around elder abuse that are more prevention strategy focused. So we kind of see Camp HOPE and then our elder justice work around fraud and scams as kind of being the sandwich around prevention. So preventing future crime to young people, but also to senior citizens. So we've just had some real good outcomes with that and are getting some good feedback, having people disclose things that they haven't disclosed that are turning into police reports, that are turning into catching scammers. We had that example last week. So we really see some opportunity, and I think it's built. One of the best things both Camp HOPE and our elder justice work has done is extended our partnerships beyond those folks in the building. So it allows the folks in the building to do what they need to do, and it also kind of grows some momentum around what the Family Justice Center is for the community through some more external partnerships in addition to our internal partners.
Fantastic. Well, I think that's a very positive way to end our call, to be very conscientious of everyone's time. So, Michael, anything you want to share?
Well, I just want to make sure everybody knows. I know there's a slide we're having our webinar on this coming Friday with our Voices members from across the country. We've been having Voices members come together in monthly calls from our affiliated sites. It's one of the benefits from affiliation is that you have somebody on the National Voices chapter. It's a national think tank of survivalists. And we're having that call on Friday at 10 a.m. So you'll see an email come out in the next couple of days from Patricia, but just want to make sure it was on everybody's calendar.
Okay, and if everybody has like 2 more minutes to go, I do think this question, Patricia, you put up is good. What is one thing you heard on today's call that you're going to implement? Because now it gets down to the doing.
Mm-hmm.
And the crowd goes silent.
This is Mary. I want to answer first, and then I got to run because I just had a member of our Voices Committee come in to meet with me. And coming back from the Leadership Summit, I had, some very definite ideas about, the involvement of our Voices members. So for one thing, their participation in, planning, decision-making. Takesha is going to be joining me next week at a legislative roundtable that, they'll be talking about the need for legislation in New Jersey. And, it's great timing for me to bump into her, and she was interested in going there. And also, I came back from the Leadership Summit with some very concrete ideas about getting more involvement, from our voice of survivors through our Voices members in terms of decision making and operations. And this call and all of the input and information around the different evaluations that have been done has been very helpful.
Thank you.
So, Michael, we'll be in touch because I'm not sure that I'm either missing the emails for the Voices Network calls, but I'm going to bring that opportunity to our Voices chapter because I think they might really like to be part of that national network.
When you get that person, just drop me the email and I'll include her or him in the calls going forward.
And we'll double check our list to make sure everybody's on it. Does anyone else want to share?
Okay, thanks. Bye.
Bye.
Okay, our busy directors need to go. You can always email us back with that one thing that you learned. If not, we look forward to next month. And next month, what are we going to cover? So you can bring your great ideas. Let's see, chapter 3. Oh, there it is, right in front of me. Sorry. Oh, governance and organizational leadership. That's a great topic. The pros and cons of government-led family justice centers, community-based, or the new hybrid, where both government and private organizations work very closely together. And we have certainly learned a lot in that area. So thank you, friends. Please join us for our upcoming webinars. Stay safe and stay positive. Bye.
Bye.
Thank you. Bye.
Bye.
Bye. Much to do.